I mean, the AMA is open to listening to proposals from private health insurers and how they might engage in primary health care. But I think we have to realise that the motivation of private health insurers is to increase their market share and obviously increase their profits. Now, what I spoke about at the National Press Club was about the foundations of our healthcare system. Its universality, its access to healthcare, particularly general practice, and the equity of that access. There's also the independence of the doctor-patient relationship. So what we're seeing is private health insurers more interested in general practice and primary health care and wanting to get into that environment. Now, we need to be careful that any approach or change that's made to enhance that access doesn't jeopardise the foundations of our healthcare system. So while we're open to listening to ideas and how they might support general practice and get a better outcome for patients, what we don't want to do is seeing patients with private health insurance, for instance, put ahead of those without private health insurance, such that those without private health insurance are squeezed out of being able to access a GP. We don't want private insurers interfering with the ability of a GP to refer to the specialist that they feel is most appropriate, or to order the tests or prescribe a course of treatment that they feel is the most appropriate for that particular patient. So that is the focus of the AMA, and that's how we want to make sure that the foundations of our healthcare system, which does deliver a good outcome for our patients, is maintained. No, they're very proactive in actually looking at how they access general practice and primary health care. We've seen the Medibank IPN trial in Queensland. We're seeing that expanded, and that's a way of getting around the current legislation, which prevents them from insuring for the gap or any co-payment. They're obviously paying an administrative fee to IPN to allow their patients to be prioritised. So we know that they're very active in this space. This is something that the private health insurers will continue to develop. We know that the government is very interested in seeing how they might contribute to primary health care and general practice, but it needs to be done in a very, very careful way to make sure that we protect our patients and our healthcare system.